Thank you guys so much for taking time out of your busy schedules. I know sometimes it's hard to get here. Today I just want to talk to you guys about Duchenne's muscular dystrophy. This is something that is very dear to me. I do have two nephews that both have this disease. Duchenne's dystrophy is actually a problem in the muscles. It's where you're lacking dystrophin, which is a protein in the muscles. This disease usually affects boys. It can, however, affect girls. It's just not as common. The carriers are usually women, and they are women, and they give it on to their children. A female that does have this gene can give it to her son or daughter. If it goes to her son, there is a 50-50 chance that he will have the disease. And if she gives it to her daughter, there's a 50-50 chance that she is a carrier that could give it on to her children, and so forth. There are several different symptoms that you can have with this. The first one can be fatigue. There's also a hard time walking, jumping. There's cardiomyopathy. It's actually a heart disease that usually comes on later on in life. There's frequent falls. The kids have problems with their sturdiness, and if they do fall or they're low to the ground, it's hard for them to get up. They have very weak muscles. This disease can actually start when you're very small. You usually start noticing things about age 3, and they have problems with their motor skills, talking. Sometimes they're a little bit behind in school. They're a little bit wobbly. They have a hard time walking, and it's just something that you notice. If you do have a child that has it, there are tests that can be ran, and if you do find out that they have it, there's things that can be done early on in life. They can take steroids to help with their muscles. They can do physical therapy, and also if they're having speech issues, they can have speech therapy. Sometimes there's difficulty breathing, and that also has to do with your heart, which should be monitored all the time. At least every 6 months they should have their heart checked. The carriers, like I said, are the women. It's usually the moms are the carriers, and they pass it on to their children. The carriers have a normal dystrophin gene, which is X, and this shows it right here. There's a little diagram of how it all works out. The abnormal dystrophin gene is the other X chromosome, because women have X and men have Y. If the woman does give it to her daughter, she has a 50% chance of passing on her children, like I said. And if you do think that your daughter might have it, she can be tested as early as you would like her to. Sometimes my brother and sister-in-law, they've given their children options to see if they want to be carriers, so it's just really what you want to do. And then right here, this shows the muscle, and it shows what they're missing, the fibers and everything, how this works. This is the dystrophin that they're actually missing. Over here it shows the different muscles that can be affected. Usually it starts in the legs, and then it can work up to its shoulders and things of that nature. Like I said, there's lots of tests that can be ran if you think your child has it. Obviously there's genetic testing if you are a carrier to see if it's something that you're going to give to your child. There's also, you could do biopsies to see if they have it. There's just different tests that can be ran. There's also different treatments besides the physical therapy and steroids. There's also leg braces, and unfortunately, all these kids right now, because there's not a cure for this disease, they all end up in wheelchairs. Usually you start seeing that effect between the ages of 10 and 12, some a little bit older. The life expectancy right now is early 20s, but my sister-in-law's brother, he actually is in his early 30s, and he is still alive. He is on a respirator, but he's alive and in very good spirits. So if you're living with it, it's not the end of the world. The kids can still play when they're little. When they get older, they're still able to mobilize themselves. Although most of the time they are in a wheelchair, they're still able to get around and play with the other kids. So it's really, honestly, it's not the end of the world. So I do have pictures right here. These pictures right here are actually, these ones are my little nephews. This one right here, he actually has it, but he's younger, and so he's not in a wheelchair. However, his brother right here, he's older, and he is in a wheelchair. This is my brother's family right here, and his wife, Christy, is actually the carrier. And so she is the one that gave it to both of her little boys. And right here is Matthew again in his wheelchair. This was at Make-A-Wish Foundation. They got to go to Florida for their Make-A-Wish. And then this is all the little kids together. This is them again, Matthew and Garion. And you can tell right here Matthew actually is able to still stand up. And right here, this is my sister-in-law and her sister, and then their brother. And he's about 32 in this picture, and as you can see, he's still, although they propped him up on the couch, he's still alive and doing good. So anyway, I just want to thank you guys so much for coming and listening to this, and I hope that you've learned more about this disease. And if you want to make donations, you can make donations to the MDA. Thank you so much.